My name's Karen Brierton and I'm a dietitian working at the Edinburgh practice. I've been here for just over a year and I have been working for around 25 years in the NHS mainly and in private practice. So ARFID stands for Avoidant Restrictive Food Intake Disorder. It's characterised by persistent avoidance of food, which can lead to a failure to meet nutritional requirements. So that often will result in weight loss or failure to grow in children or in nutritional deficiency. ARFID can affect any age group, it's not just children. ARFID is not driven by body image concerns or weight loss goals or other eating disorders such as anorexia or bulimia. There are 3 subtypes of ARFID and an individual might have one or all of the subtypes. The first subtype is sensory differences, so that might be a sensory difficulty with the taste, the smell or the texture of foods. The second would be lack of interest, so that means that a person may have absolutely no interest in eating at all, or they might have inability to recognise appetite or hunger cues. Third would be a fear of aversive consequences of eating. So what that means is that somebody might have a fear of choking, they might have a fear of vomiting. That might be because of some event that's happened earlier in life and it just completely puts them off eating because of that worry about it. So an initial appointment to see me would involve an hour initial assessment process. The assessment would involve a full screen of the individual's diet and looking at what are the difficulties. Do they have worry about the sensory elements? Do they have a lack of interest in eating? Do they have a significant fear about choking or vomiting? I would do quite a detailed dietary analysis. So are there any specific nutrients that people are lacking? Have they likely got nutritional deficiencies? Do they perhaps need blood tests done to outrule those? I'd also look at their weight and their height. If they're a child, I would plot them on growth charts to make sure that they're thriving, that they're growing adequately. And if not, that might be something that we would discuss in the next appointment for treatment approaches. During appointments for younger children, it could be parents alone that attend the sessions, or they could just bring the child for a small part, depending on how they manage that. A follow-up appointment usually would last about half an hour, or can be longer if required, and this would look at forming a treatment plan and having a think about the next steps to help the individual. How do we manage to get more food into the individual's diet? Can we address if they're underweight or if they're overweight? Also, can we have think about, do they need to challenge new foods? Do we need to think about graded exposure so that they can then introduce some new foods into their diet safely with the least anxiety possible? I might also have a look at if they're finding it difficult to eat socially. I would support them to be able to do steps towards managing that too. So the Edinburgh practice is a great place to come because we work as a multidisciplinary team. So for somebody with ARFID, that's really vital. And there's access to speech and language therapy, occupational therapy, psychology, as required by the individual. I think it's seen that people are able to just open the world up to having some new foods in their diets. Often for the parents it's really, really stressful when they'll only eat maybe 5 or 6 different foods. So being able to take their child out to a cafe or a restaurant and have more foods that they're able to eat safely and without any worry, so it just, you can see all these sort of what we take as for granted really be normal becomes an easier part for them, so that's always really rewarding to see.